whoever that was. First of all, I want to welcome everyone, the Honorable Supervisor, distinguished doctors, community leaders, and members of the press. Thank you all for coming. I especially want to thank the members of the press because I think you guys are the unsung heroes, really, in this situation, because we depend on you to disseminate the accurate information to the public. And you are in a position to change behavior. So I want to thank all of you for what you do to save lives and reduce suffering. So I think that can't be underestimated. And as you know, we have many trusted sources of information about this terrible pandemic, and we're grateful for all of them. The San Francisco Department of Public Health, the Office of Emergency Operations Center, the Mayor's Office, CDC, WHO, and we use all of these sources of information. But we're here today because there's very little information that's community specific. And there's a lot of misinformation, and I think this leads to a lot of confusion in our community. So some of the community-based organizations got together and they said, we have this idea that it would be helpful if we got the trusted physicians, our community leaders, our community professionals to get together to look at the information, discuss it, and disseminate it, and interpret it in a way that applies to our own Chinese community. And in this way, we're coming together as a task force to get this done and to continue to communicate with our beloved media. I want to say that the doctors thought of this great idea, but it wasn't the doctors. But the doctors in the hospitals have really come on board to buy into this and are happy to participate. And I want to say it's community-based organizations who we need to thank, and in particular Annie Chung and Linda Wang who put this together today. Going forward, this task force is going to continue to meet and continue this informational outreach and do this at regular intervals and distribute these things we pull together through our own networks. We all have our own networks, plus with Chinese radio, Chinese TV, Chinese newspapers as the situation unfolds. I want to mention today we're practicing strict social distancing. We're trying to keep the room less than 10 people. We're 6 feet apart, and that's very important, and I think it's going to contribute to the success of what we're doing. Lastly, I want to emphasize that protect yourselves, wash your hands, clean your hands frequently, avoid touching your face, and stay at home and avoid close contacts. Esther's going to do, Esther, I want to introduce Esther C2. She's the Director of Education at CCHCA, Chinese Community Healthcare Association. She's going to do my part in English. We're doing a bilingual presentation.
Okay, thank you, Dr. Wu. 首先咧，歡迎大家尊貴嘅市議員、醫生們、社區嘅領導同埋傳媒。特別歡迎你哋嚟到我哋第一次嘅華人社區抗疫嘅聯盟記者招待會。我咧就首先要感謝社區嘅傳媒嘅出席啦，因為咧要感謝佢哋喺呢段嘅時間裏邊咧，好準確咁提供新冠狀病毒疫情嘅信息，喺呢度咧發揮咗咧至關重要嘅作用。呢個信息咧係可以挽救生命並且咧係減少好多人受呢個疾病感染。更重要嘅咧就係關於呢個疫情大流行咧，有好多可信靠嘅信息來源，就譬如咧呢個三藩市公共衛生局緊急行動中心、市長辦公室同埋呢個疾控中心。但係咧目前社區嘅有關嘅資料咧仍然係好少嘅，並且咧出現咗咧錯誤信息氾濫嘅現象。因此咧，我哋嘅社區嘅機構咧有咗以下嘅想法，就將呢啲值得信任嘅社區嘅領導員同埋專業人士聚集埋一起， 去討論同埋咧發布最新嘅信息。呢個咧就以適用於我哋華人社區嘅方式咧嚟進一步去解釋。我哋覺得咧咁樣做咧係令到華人嘅社區嘅團體咧了解呢個疫情有好大嘅幫助。我想講咧呢個係醫生提出嘅想法，但係咧其實咧呢個係基層民眾嘅想法，而醫生咧同埋呢個醫院咧都係好樂意咁參與。喺呢度咧，我哋特別要感謝鍾月娥同埋黃妙兆兄，因為咧佢喺呢個過程裡面發揮咗咧好重要嘅幫助。接下來咧，我哋呢個工作組呢個華人社區抗疫嘅聯盟咧，就會開會討論，並且咧就根據情況定期咧就通過我哋嘅網絡系統包括咧呢個社區嘅新聞報紙中文電台同埋電視台去發布呢啲有關嘅信息。呢家我哋都保持呢個社區嘅距離人與人之距離去保護咁今次咧我哋呢次嘅講員咧都係好多咧都係透過呢個視頻咧進行發布同埋交流包括我在內而現場咧個人咧都係喺度保持緊6尺嘅距離。最後咧，我想強調嘅咧係大家都要好好保護自己，經常洗手避免咧觸摸面部，盡量咧都要留喺屋企避免咧與其他人咧近距離嘅接觸。咁特別多謝大家嘅光臨，同埋多謝大家。
Okay, thank you, Esther.
Yeah.
I actually, at this moment, have the great honor to introduce the Honorable Supervisor of District 3, Aaron Peskin.
Thank you, Dr. Wu, and thank you to Annie Chung and Self-Help for the Elderly for organizing today's press conference. My name is Aaron Peskin. I am a member of the Board of Supervisors and the Board of Supervisors liaison to the Emergency Operations Center that has been up and running for the last couple of months. And I've been there full time almost the last 10 days. As everybody knows, 10 days ago, on March 16th, the mayor of the city and county of San Francisco, London Breed, issued an emergency stay-in-place order that was followed later by the governor of the state of California, Gavin Newsom. And I am here to talk both about the steps that the city has taken as well as information that members of the community need to know about. First of all, I know that this is a very difficult period for everybody, seniors, adults, families, children, businesses, and I want to thank everybody in the community, all of the residents of San Francisco, all of our frontline workers for your patience and understanding. I also really want to thank the doctors and the medical community for the information that they are providing to myself, my colleagues, and the mayor. The information that we are getting from some of the best health professionals in the world is that the social distancing practices that the mayor and governor have mandated not only for this city, but for the entire state of California are going to reduce the level of the spike in coronavirus cases and in coronavirus deaths. You may know that today, almost all 192 countries on the planet Earth have coronavirus cases. Over 450,000 cases are now documented on every part of this planet. The number of deaths today has exceeded 20,000. There are over 12,000 additional serious cases. Some of those people recover. Some of those people are not going to recover. What we found, and our doctors have found from the experience in Wuhan, China, in Hubei province, as well as what is now happening in Italy, is that we can actually defeat this virus through some very, very basic steps. The virus will die if we can stop the rate of community transmission. On average, everybody who has coronavirus transmits that to 3 other people, and so it explodes. That's exactly why in Italy today you see over 7,000 deaths. The best way to stop it is very simple. And Dr. Zhang, the CEO of Chinese Hospital, said this at the first press conference that we held over a month ago at the Chinese 6 companies. Wash your hands for 20 seconds. When you touch a surface, don't shake people's hands. Stay 6 feet apart. Do not get any closer than 6 feet from another human being. Now, I've said a lot of things, and I am going to have my friend from the Department of Emergency Management, Victor Wai-Ho Lim, translate that first part. Then I'm going to come back and speak some more, and I will stay here all the way through to respond to questions that you can ask of the nonprofit community in the form of Ms. Chung and Reverend Norman Fong, of the medical community that is represented here by AAMG, by St. Francis Hospital. I do have news, which is St. Francis Hospital is actually opening up an additional 48 beds so that when the surge hits, and I'll tell you more and answer questions about our hospital capacity, and I will tell you the number that we have today, which is 172 cases as of 9 o'clock this morning in the city and county of San Francisco, and I'm sad to report our first death from coronavirus happened yesterday in the city and county of San Francisco. And I want to thank Captain Yick and his officers for all of their work, as well as the working men and women of the police department throughout the city and county of San Francisco, the fire department, and the heroes that are going to be our nurses and doctors. We are now hiring nurses literally on the spot. We hired 82 nurses this last weekend. We are trying to hire another 90 nurses so that we do not end up in the situation that New York City is in, where their hospital beds are jammed, where they don't have enough medical staff, but there are challenges. The supply chain is very limited for a number of things, including ventilators, testing kits, swabs for taking tests, as well as very basic things like cleaning supplies to clean counters. And I'll speak more about that later as it relates to our congregate living settings, particularly in Chinatown, single resident occupancy hotels. So I'll get to that in a minute. Mr. Lim.
大家好，我係林偉豪，三藩市應急管理局嘅外務特派專員。咁我會同史參事佩斯金作嘅簡短嘅翻譯嘅。咁剛才咧，史參事佩斯金咧就話咧，佢過去呢10日咧就已經喺我哋三藩市應急管理局嘅緊急指揮中心嗰度一直工作，咁密切咁了解到我哋嘅三藩市所需嘅情況啦，同埋而家呢個擴散嘅情況嘅。咁咧，市長布里德咧就喺3月15號嗰日咧，亦都係頒布咗個居家避疫令嘅。 咁就係向所有我哋三藩市嘅市民咧，係要求我哋一切如果係非必要嘅咧，如非必要請留在家中。咁但係咧，澄清一下就係、如果長者或者其他係需要買食物嘅或者必需品嘅，都依然可以出街嘅。咁收尾同一個禮拜咧，喺禮拜4咧，州長紐森咧，亦都公布咗向我哋全加州咧，亦都有一個全省嗰個居家避疫令嘅。 咁所以咧，我哋而家市政府同埋州政府咧一齊係密切咁合作緊啦，同埋而家非常困難嘅時期咧，希望我哋所有市民咧都係攜手合作咧，共度患難嘅。咁亦都同時咧，多謝我哋所有嘅醫務人員啦，我哋嘅警隊啦，我哋消防隊啦，我哋應急管理隊啦，所有社區嘅人士啦，多謝我哋鍾月娟啊，同埋我哋所有醫生啊，同埋我哋社區團隊嘅。咁而家咧喺社區咧有好多唔同嘅 資料或者信息，咁所以咧，經過呢個三藩市應急管理中心嗰個指揮局嗰度咧，就一齊合作，向我哋華人社區咧作出一啲最準確嘅信息，特別係可以喺中文嘅俾我哋大家知道嘅。咁咧，關乎到社交距離咧，我哋要強調咧，就係人與人之間咧，最好就要有6英尺嘅距離嚇，即係話如果我哋放一隻手嘅話咧，唔應該 有同任何其他人接觸嘅，特別係同陌生人嘅。咁咧喺嗰個個案咧，而家全球咧有192個國家咧都有確診嘅病例。咁剛才咧史參事講到咧案例咧有超過目前45萬宗，咁咧有大概咧2萬宗係非常之嚴重，即係萬幾宗係特別嚴重嘅。咁咧就希望我哋亦都同時間咧可以學到呢個武漢同埋意大利嗰個經歷啦。我哋而家係最緊要迫切嘅就係減低呢個病毒呢個擴散咁咧同埋社區傳播，因為一個人如果佢係帶病嘅話咧，可能係會可以感染到最少3個人，咁呢個可以倍數增長嘅。咁咧之前我哋係同我哋東華醫院華人社區咧一齊密切咁合作。最緊要咧，我哋要提醒所有市民咧係要勤洗手，洗手咧最少洗咗手之後有番梘捽20秒，嗰個係最有效嘅呢個防疫嘅措施嚟嘅。咁咧同埋咧，我哋而家三藩市咧呢個病床同埋醫院咧都係非常之緊迫，同埋我哋希望可以增加我哋嗰個病床同埋呢個深切治療床位 ICU 床位嘅。咁再次咧，我哋多謝警隊啦、消防隊啦、護士人員啦，同埋我哋市長咧同埋市政府咧做咗一個緊急嘅聘請，已經請咗82位嘅護士。喺呢個過程咧，我哋都係準備聘請多90位嘅護士人員去幫助呢個疫情嘅。咁同時間咧，市長今日咧亦都講咗有關我哋嚟緊呢1-2個禮拜會面臨呢個急劇增長嘅可能性，要做好呢個未雨綢繆嘅準備。咁關乎到散訪同埋我哋華埠社區喺呢個非常之緊密嗰個居家嘅問題同埋挑戰咧，陣間咧史參事亦都會同大家一一解答嘅。咁呢個係第一嘅翻譯。I'm sure in English too. Hi, my name is Victor Lim, External Affairs Officer with the San Francisco Department of Emergency Management at the Emergency Operations Center. On behalf of DEM and the EOC, we want to thank everyone that's here today for putting this press conference together. We want to emphasize the importance of social distancing. We know that in the Chinese American community, a lot of us in Chinatown especially are still doing grocery shopping, vegetables, and essential operations. A lot of seniors need to buy the groceries in Chinatown. But we want to take this opportunity to remind them when they do shopping and groceries, please practice social distancing with at least 6 feet. If they do not practice this and this situation worsens, we may have to work with our law enforcement partners to not just educate, but to potentially enforce. But at this time, our partners at SFPD and our various departments, we're taking a community education approach to encourage everyone to practice good social distancing. 咁咧，我係僅代表我哋應急管理局同埋我哋緊急指揮中心咧，向我哋市民咧再強調咧，呢個社交隔離咧係非常之重要嘅，因為我哋而家咧個首要任務就係要將呢個疫情嘅擴散咧係減慢嘅。咁我哋見到喺其他嘅區域喺其他嘅市同埋州份咧，都係非常之嚴重，甚至乎國家嘅。咁所以咧除咗剛才我哋講話洗手咧，呢個社交距離喺特別華人嘅超市，我哋知道咧啲超市嗰個非常之狹窄嘅，同埋咧可能佢買嘢嗰陣時咧都係好難保持距離，所以咧大家希望可以禮讓一下，同埋咧如果你見到人哋係揀緊菜或者生果呢啲咧，唔需要同時間揀嘅，因為咧我哋物資係非常之充足啦，我哋啲東家咧都明白到我哋華人社區嘅需要，咁咧所以咧如果大家守望相助咧，自律喺度隔離咧，咁我哋就唔需要強制，但係我哋而家三藩市警隊係希望去向市民解釋同埋教育呢個社交距離嘅重要性。但係如果市民係依然唔聽從呢個社交距離令咧，咁警隊咧可能會保留呢個執法嗰個需要嘅。多謝大家。
Please. So, first of all, I want to let you know what is happening in the emergency. Good. Thank you, Mr. Lim. So first of all, I want everybody in the community to know what's happening at the Emergency Operations Center. Most importantly, in addition to working between all of the hospitals, so that includes San Francisco's General Hospital, That includes the hospitals in the Sutter CPMC hospitals, as well as the Dignity hospitals. That includes St. Francis, as well as Chinese Hospital here in this community. We are all working to thin out the existing populations in those hospitals in order to make room for what we think is a surge that could come in the next few days or the next couple of weeks. All non-elective surgeries have been canceled, and the number of folks in those hospitals are going down so we can make room for COVID-19 coronavirus patients. That is going very well across both the public and private hospitals, and I really want to thank Dr. Grant Colfax and his team at the Department of Public Health. We know from the Wuhan experience that isolating people and quarantining people who have COVID-19 is going to stop community transmission and the spread. Many of our constituents live in congregate housing sites like the 160 single resident occupancy hotels in San Francisco that house almost 20,000 people. To that end, the Department of Human Services, under the leadership of Trent Rohr, with assistance from me and my team, have been working with the Hotel Council, and we have now been in touch with over 35 different hotels that have offered us almost 10,000 units that we can use for isolation, for quarantine, for people on the streets, as well as for our first responders. I want the working men and women from the hospitals to know, I want the police to know, and the fire department and the deputy sheriffs to know that if after you've been out on the street for a day and you're worried, I don't want you to have to go home and worry about contaminating your family. So we are ramping them up day by day, the number of hotel rooms that we're going to have. Obviously, first responder hotel rooms will not be in the same hotels as isolation and quarantine hotel rooms, Captain Yick, so you can rest easy at night about that. So those are the steps that we're taking on that front. And hopefully, we won't have such a large explosion of COVID-19 cases that will need all of those rooms, but we are entering into contracts with all of them in case we need them. In addition to that, obviously for some populations, access to food is going to be phenomenally important during the COVID-19 period. On the nonprofit side, self-help for the elderly has been extraordinary. With teams of volunteers bringing food to vulnerable populations that need it. The city is supplementing that on the public side through our operations team at the EOC and our logistics team at the EOC, where we are getting ready to mobilize feeding sites throughout the city, as well as home deliveries to tens of thousands of people. I would also like to address the economic impacts. The economic impacts are real, they are harsh, and we know that many, many people live not only from paycheck to paycheck, but in many cases from day to day. The state has been helpful under their emergency order in providing for various kinds of relief, whether it's unemployment, paid sick leave. If you go to sf.gov, you can find that online. If you need to speak to somebody in Cantonese or Mandarin or Toisan, you can call 311 and you will get responses there as to what different programs you can avail yourself of. As you know, yesterday the United States Senate voted on a $2 trillion with a T dollar package that would have hundreds of billions of dollars to help local governments like San Francisco on a variety of different fronts. The House of Representatives passed a slightly different version, so they are now reconciling those versions. The President of the United States has not yet signed it. The details of some of that language is going to make a lot of difference to people's lives. I am not ready to report about that because it is not final, but help is on the way from the federal government. On the local level and on the state level, if you are unable to pay your rent, We have passed emergency orders that say you cannot be evicted either from your residence or from your place of business. And today, the governor of the state of California announced that virtually every major financial lending institution in the United States of America has agreed to a forbearance of mortgage payments for 3 months in the state of California, every single one except for Bank of America. And I would imagine that the pressure on Bank of America right about now is such that they will fall in line with the other 400 lending institutions. So if you're worried about paying your mortgage, don't worry for 90 days. Look, this is something that is so profound that our entire society is going to have an economic reset when we are all safe. I also want to thank the state of California because as the doctors here know, and as our first responders know, having what's called personal protective equipment, whether it's gloves, an N95 mask, for the nurses and doctors, face shields, and full protective clothing is going to be very important. A lot of the coronavirus cases, including a significant amount of the mortality, has happened in the healthcare industry. We cannot have that happen here. There is a shortage of personal protective equipment, not only in this city and this state, but in every country in the world, as you might imagine. Yesterday, the state of California opened their caches of personal protective equipment, and a truck rolled into the city's reserves with 1 million N95 masks that we will allocate to our first responders appropriately. Finally, I would just like to speak to the steps that we are taking in SROs, where people share bathrooms, where people share kitchens, which can be a very transmissive environment for the spread of the virus. And to that end, and I want to thank Mayor Breed, we collaborated very early on. We are spending over $5 million a month to deal with issues in congregate housing. That also includes shelters. But the most important part of it is that we're spending $1 million a month on something very basic, which is cleaning supplies. So there are two kinds of SROs, those that are actually ones that have some relationship with the city, many of them under the Chinatown Community Development Center, and we are making those supplies available to them. The Chief Health Officer of San Francisco is issuing a health order, which if it is violated is a misdemeanor crime, about increasing the amount of cleaning that SRO owners and managers are required to do with objective standards. So in the old days, these were generally cleaned once a day. Now they're going to have to be cleaned multiple times a day with directions as to what has to be wiped down, whether it's kitchen surfaces, table surfaces, handrails, and we have hired additional inspectors and given those inspectors personal protective equipment so that they can go in there and issue citations that can be a misdemeanor crime in the city and county of San Francisco. If anybody, and the doctors will say this with much more authority than a supervisor, but if anybody has influenza, flu-like symptoms, they should call their medical provider. If they do not have a medical provider, they should present themselves to one of the clinics in the immediate neighborhood where medical professionals will be able to figure out what the appropriate regimen is for that individual. Together, I am confident that San Francisco is going to get through this. I want to thank everybody for their cooperation, for their patience. This is an extraordinary time, and we are taking extraordinary measures. And I think when this is all done, while San Francisco is going to see many deaths, and I don't want people to think that that is not going to happen, I think because of the very aggressive steps that we are taking, are going to be much better off than surrounding areas of the region, than other cities and other states. So thank you again for your patience. Mr. Lim will translate that, and then there are many other speakers that you will hear from, and I will stay for any questions. Finally, I just want to say one other thing. which is that our streets are much easier to patrol. There are very few folks out there now. Our crime rate has gone down significantly. Chief Scott said that in a press conference earlier this week and said it again today at the Emergency Operations Center. And so we now have many competent and linguistically competent officers who are going to be able to help with social distancing. They have done that already in Portsmouth Square, for which I would like to thank Captain Nick and his staff. And let me just say this, and this is very important that you cover it. Playing cards next to each other is not worth dying over, so cut it out.
好多謝我哋市參事佩斯金嘅。咁第二段咧，剛才佢講咧就係而家我哋應急指揮中心咧就同緊我哋全三藩市所有嘅醫院啊密切咁合作嘅，包括我哋三藩市醫院啦、太平洋醫療中心嗰啲 CTMC 醫院啦、Dignity Health 包括聖法蘭西斯醫院啦、東華醫院等嘅。咁咧呢啲咧都係我哋而家為咗呢個抗疫嘅措施咧係聯手抗疫嘅。咁亦都咧呢個係我哋衛生局長Dr. Grant Colfax 咧一直有強調嘅。咁咧而家我哋三藩市咧散訪嘅問題咧都係好嚴峻嘅，因為我哋全三藩市有超過160多個散訪大廈，咁咧居住嘅散訪人數咧有超過2萬人嘅。咁所以咧，我哋而家同緊三藩市嘅福利局，即係呢個 HSA 嘅局長 Treadwell 咧，一齊咁密切咁合作緊啦。咁咧就亦都經過市參事佩斯金同埋我哋市政府咧，亦都係談判同埋協商緊咧，同我哋有35個唔同嘅酒店咧，就係攞佢哋嗰啲，即係同佢哋啲酒店房，咁俾我哋超過呢個10萬人嘅需要咧，可能係流浪漢或者我哋散訪嘅住客係無法自我隔離嘅，可以到酒店嗰度咧係強制隔離嘅，因為呢啲人士咧係未必需要入呢個醫院嗰度檢疫嘅。咁咧同時間喺我哋呢個增援率咧，我哋希望我哋而家呢啲強硬嘅措施咧，可以減低我哋呢個增長，因為而家所見到嘅個數字增長咧，係我哋做緊測試，係因為居家隔離之前可能已經得病感染嘅。喺呢個隔離嘅情況咧，呢個提供食物係非常之重要，所以我哋都同福利局同埋市府所有部門咧，向我哋所有嗰啲喺呢個長者獨居老人啊，或者佢哋住散房咧，可以提供咧適當嘅食物，可以送啲食物到府上嘅。咁亦都同時咧，多謝我哋社區嘅機構咧，特別呢個我哋Shelter for the Elderly， 我哋安老自由處同埋其他嘅社區機構咧，一直喺過去呢幾個星期咧，為我哋社區咧同埋我哋社區嘅長者提供需要嘅食物到府上，等佢哋唔需要落樓去特別買嘅咁同埋喺應急管理局咧，我哋亦都密切咁同緊我哋logistics， 我哋其他嘅同事咧安排我哋嘅物資同埋人事嘅調派嘅。所以喺呢個資料方面咧，我哋每日嘅資料咧都有更改啦。咁希望大家亦都可以去 sf.gov 嗰度咧嗰個網站上去查詢呢個資料。我哋如果上網係唔方便嘅，講國語粵台新聞嘅朋友可以打311致電311。咁我哋而家咧國會咧就之前講緊有20億呢個2 trillion 嗰個撥款。咁而家我哋國會嘅參同埋眾議院咧依然喺度商討緊。咁總統特朗普咧依然係未簽署呢個法案嘅，希望呢啲撥款喺聯邦政府咧盡快可以撥落嚟。咁我哋關乎到州政府同埋三藩市租屋嗰個問題，即係 Big 10 evictions 咧，亦都係暫停咗，同埋咧係喺呢個貸款方面同埋公屋咧，州長咧已經同多數嘅銀行，除咗幾個銀行之外咧，係有90日嗰個延遲交呢個公屋嗰個資金嘅。咁咧同埋咧呢個 PPE 即係個人保護嗰啲物資咧，手套啊、衣服啊都係非常之緊要，因為我哋前線嘅工作人員、我哋醫療隊、我哋其他啲檢察嘅同事、警察啊、inspection 嗰啲咧，都需要着呢啲衫，但係物資係非常之短缺。咁咧同時多謝我哋州政府咧，之前有撥咗100萬個口罩俾我哋呢個三藩市政府俾我哋各個部門有需要嘅人士嘅。咁喺散訪家庭咧， 而家個新嘅措施，關乎到要清潔同埋清洗咧，係已經增加咗撥款，有500萬元係為咗呢個清潔嘅撥款同埋流浪漢嘅。咁其中100萬元咧係專門為咗去買呢個清潔嘅物資嘅。咁喺散房嗰方面咧，我哋有2種散房。一種散房咧係直接而家接受我哋市政府佢哋嗰個撥款，例如華協中心屬下嘅散房家庭啦。但係亦都有大部分嘅散房係其實私人嘅樓宇嘅。咁我哋而家係增加咗我哋喺政府嘅 inspection 嗰啲調查嗰啲調查員咧出去睇下邊啲有違例嘅情況，盡快咧就發出告票，同埋要求嗰啲業主係要盡快咁樣作出呢個改善同埋清洗嘅。咁如果有人有病嘅話咧，就希望佢哋盡快係同佢哋嘅家庭醫生盡早聯絡。如果佢哋冇家庭醫生咧，就可以到我哋政府唔同嘅衛生局或者其他嘅診所去之前打電話確診查詢之後求醫。咁喺呢個疫情咧，我哋亦都要呼籲市民咧即係我哋首先多謝警局嘅工作啦，因為而家人少咗出街，呢個犯罪嘅罪案咧亦都減少咗。咁市參事咧亦都係強調，特別喺花園角咧賭牌嗰啲咧打紙牌嗰啲咧，盡量減少啦，因為啲紙牌咧好多毒嘅，佢可能會傳染，所以咧記住切勿去賭博啦。多謝大家。Yes， 多謝。
Thank you, Mr. Lim and Supervisor. I have the distinct pleasure to introduce one of our private practice ophthalmologists, and as it turns out, my boss, the chairperson of the board of AAMG, Dr. Eric Lim. So we should switch to Dr. Lim.
Hello.
We'll switch to Dr. Lim.
Hello.
劉醫生，你聽唔聽到我哋？
喺度，我喺呢度。
OK， 咁你可以開講今日。
好。各位朋友，各位鄉親父老，我係梁禮崇醫生，我係美亞醫療集團嘅主席。而家呢個冠狀病毒嘅疫情已經登陸美國啦，喺全美國而家有5萬個病例，我哋加省亦有2500個病例，而我哋灣區呢有好幾百，係差唔多近1000個病例，所以喺呢度呢，我想同大家講下點樣喺個人方面防止係感染呢個病毒，而喺地方方面，我哋點樣可以防止呢個病毒係傳播我哋嘅社區，同埋呢，如果你真係有病，好似有流感嘅病徵，或者你係覺得中招，咁應該點樣做呢？咁首先喺個人預防方面呢，我哋要注重我哋個人嘅衛生，即係呢，我哋要頻繁嚟洗手，我哋要用番梘同水喺我哋嘅手嘅面、手嘅背面同手指嘅中間嚟，盡量咁洗手洗潔乾淨，最少係20秒嘅時間。如果我哋譬如喺街上邊係冇呢個水嘅話呢，我哋仍然係可以用有60%以上嘅水晶嘅消毒液嚟洗我哋嘅手。咁第二呢，喺我哋居家方面呢，我對於居家嘅家私啊、台面啊、countertop 呢，我哋要頻繁咁用呢個番梘或者消毒液嚟保持清潔。同時呢，第三呢， 我哋可以盡量避免嚟摸我哋嘅面或者係眼、口、鼻，尤其是如果我哋係唔可以確定我哋係嗰個手係乾淨嘅話，因為如果我哋係摸我哋嘅面部嘅眼、鼻同口嘅話咧，呢個病毒咧可以經過我哋呢個眼、鼻、口嘅黏膜而入侵我哋嘅身體嘅。平常嚟講咧，我哋係需要保持好嘅營養，保持身體有充分嘅水分，時常運動，同埋有充分嘅睡眠嚟增加我哋嘅防疫力同埋抵抗力。喺社區方面，點樣可以防止呢個疫情喺我哋嘅社區爆發？第一，我哋要聽從政府嘅命令，就係實行呢個就地防疫。即係講喺大多數人方面嚟講咧，就地防疫即係居家防疫啦。我哋唔應該盡量係少出去，除非我哋係緊急事情，係要購買食物之類或者睇病之類。我哋係盡量係居家，防止呢個疫情播散，同埋防止自己會受到呢個疫情嘅侵犯。咁我哋喺工作方面，除非你係緊急嘅人員或者係必須行業嘅人員、醫務人員之外咧，我哋係應該係喺屋企居家工作，留喺屋企。我哋唔應該出去同人哋接觸，更係唔應該有聚集呢個咁嘅活動，咁先至可以避免呢個疫情喺我哋嘅社區不控制咁爆發嘅。如果你係覺得有病，覺得自己係有流感嘅病情，好似打乞嗤啊、發燒啊之類，或者你係覺得自己係可能係中招嘅話咧，第一，你應該除咗係睇醫生之外，係盡量留喺屋企，除非你係有呼吸困難或者係有不能忍受嘅病徵之外咧，係應該喺屋企嚟保養，同埋令呢個病呢個流感可以自己痊癒。如果你係一定係要去睇醫生嘅話咧，你係睇醫生之前應該用電話嚟通知你嘅醫生或者診所，等呢個醫生同埋診所咧係可以有準備，同埋可以知道係點樣嚟幫助你。如果你係身體唔舒服，有呢個流感嘅病徵嘅話咧，你係應該戴起個口罩，因為呢個口罩咧係遮住你嘅口同埋你嘅鼻，咁係可以防止呢個病疫嘅傳播嘅。如果你係有咳嗽或者打乞嗤嘅話咧，你係應該用一個足夠面積嘅紙巾嚟冚住你個口同埋鼻，防止呢個口沫液體係散播。如果你係即時未曾攞得到紙巾嘅話咧，你應該用你個手踭遮住你個口同鼻，咁嚟咳嗽或者係打乞嗤，亦係咁可以防止呢個飛沫喺空中播散嚟傳染俾別人嘅。我哋美亞醫療集團嘅員工咧，已經係實行咗政府嘅要求，係居家工作。但係各位唔需要擔心，因為我哋嘅員工咧 而家咧係喺電話同埋視頻方面嚟可以繼續諮詢、繼續幫助你哋大家嘅。我哋美亞醫療嘅員工係照常嘅運作嘅。至於我哋美亞醫療嘅醫生咧，我哋亦係遵照政府嘅要求，就地防疫咁嚟防止疾病嘅播散。所有醫生已經係停止咗呢個普通嘅體證，但係我哋係可以喺電話同埋視頻方面同我哋嘅病患見面。我哋可以喺呢度係處理你嘅處理你嘅問題，解決你所有嘅生理、心理同埋病理上嘅問題。而且我哋亦有大部分嘅醫生係有一個限制性嘅開診，即係話我哋每個禮拜大概1日半日係可以喺診所同大家處理你呢個緊急嘅問題嘅。美亞醫療集團，我哋係每日確保你嘅健康。AAMG, we are open for your health。我而家用英文簡短咁翻譯我頭先講嘅嘢。I am Dr. Eric Leong. I am the chairperson of Asian American Medical Group. The COVID-19 has arrived in the United States. In the whole country, there are 50,000 people diagnosed with the disease. In California, we have over 2,500 cases. In the Bay Area, we have hundreds and close to 1,000 cases. So at this time, I want to tell our community, our patients, number one, how to prevent getting the disease, and number two, how to prevent the uncontrolled spreading of the disease in our community. And number three, if you are sick with flu symptoms or you feel that you may have caught the COVID-19, what you should do. Number one, in terms of preventing you from getting the disease, we have to have good sanitation for ourselves. That means we need to frequently wash our hands. We need to wash our hands with soap and water. We have to wash the palm part, the back part, and between the fingers thoroughly for at least 20 seconds to ensure that our hands are clean. And if you are in a situation that you do not have access to water, then you can use the antiseptic solution that contains at least 60% alcohol and use that to clean your hand. At home, you should frequently clean your countertop, your tabletop, and the surfaces that you touch with soap and water or with antiseptic solutions. Make sure they are clean and free of virus and bacteria. And do not, as much as you can, touch face, your eyes, your nose, or your mouth, particularly when you cannot be sure that your hands are clean. So because by touching your eye, nose, and mouth, the virus can invade your body through these mucous membranes. In ordinary daily life, you should maintain good nutrition, you should maintain good hydration, you should have adequate exercise, and you should have adequate sleep, so that would increase your resistance and your immunity. As to how to prevent the spread of the disease among our community, you should practice and obey the government's order of stay home, shelter in place, and maintain social distance. For most people, shelter in place, that means you should stay home and to prevent the spreading and catching the disease. Maintaining social distance, again, you should stay home and prevent going out, and in the unavoidable situation, for example, getting food, getting your medicine, or going to see your doctors, you should maintain 6 feet apart from other people so that it will decrease the chance of the virus spreading. Unless you are essential people for your occupation, or unless you are first responders or medical caregivers, you should stay home, and you should prevent having contact with outside, with the exception that if you have to get food or access medical care and getting your medication. Absolutely no visiting, no gathering, and so that to prevent the spreading of the disease. In case if you are sick or have the flu symptom, or you're worried that you may have caught the COVID-19, then you should stay home. You should stay home so that your illness have a chance to get recovered. Unless you have unbearable symptoms, unbearable pain, or unable to breathe, then you should access medical care. But before you access medical care, you should first call up your doctor or your clinic so that your doctor or the clinic can have the preparation for your visit, so that they can treat you properly, take care of you properly, and also prevent the spreading of the disease. If you are sick, then you should wear a mask. The mask should cover both your nose and your mouth, because with a mask covering your nose and your mouth, this can prevent the spread of the disease. When you need to cough, you should have a big enough clinics to cover again your mouth and your nose to prevent the spraying of the fluid in the air to prevent the spreading of the disease. AAMG, our employees have complied with the government's ordinance to stay home to work. However, we will continue to service our patients and our members through telephone and through video. We are continuing to be accessible to help you, to take care of you in this means. The AAMG doctors, we have also, all of us, have obeyed the ordinance of shelter at home and maintaining social distance. We have stopped the ordinary clinic hours. However, we will maintain connection, communication through telephone or through video with our patients. We will be here to take care of your problems. We will be here to take care of your physiological, psychological, and pathological problems. All the doctors are here for you. Many of the doctors who have limited hours at the clinic to take care of urgent problems, maybe one day or half a day a week. But we are here for you. AAMG, we are here to protect your health. We are open for your health. Thank you very much.
Thank you, Dr. Leung. Now I have the privilege of introducing another community physician, ear, nose, and throat doctor, who also happens to be the chairperson of the board of St. Francis Memorial Hospital, Dr. Mankit Lem.
多謝大家，我係梁文傑醫生，美亞醫療集團個耳鼻喉專家，亦都係聖法蘭西醫院個董事會主席。我今日好榮幸有機會同大家講關於社交距離個重要性。好似上一位梁醫生啱啱解釋，冠狀病毒係好容易傳染，而且現在嚟講，今日嚟講，我哋未有發明預防針，亦都冇藥嚟醫得到呢種病毒。所以我哋唯一一個方法嚟可以減少預防傳染呢種病毒，就係保持社交距離。好簡單嚟講，社交距離個意思咧，就係遠離其他人，盡量留喺屋企，冇出街。如果真係需要出街，就要離開其他人最少6英尺，盡量避免多人嘅地方，亦都冇同人握手。自己人人都應該多啲洗手多啲，亦都盡量避免捽眼啊、捽鼻啊、掂口唇。Okay? 如果係擔心有感染到冠狀病毒咧，最好就通知自己嘅家庭醫生。而家好多醫生都可以喺電話上，抑或喺電腦網上嚟診斷。如果係有嚴重啲嘅症狀，譬如發高燒，抑或有呼吸困難，就最好去急症室嚟檢查。我哋聖法蘭西醫院已經準備好幾十張病床，就特別照顧有病毒嘅病人。而且我哋成間醫院全部啲工作人員，包括護士同醫生，都有通過一個特別嘅培訓嚟學識最安全個方法嚟照顧有病毒嘅病人。但係大家都希望唔需要經過咁難過嘅情況，所以今日我最重要就係請大家為人為己，保持社交距離，為咗預防傳染冠狀病毒。多謝大家合作。So my name is Dr. Mankit Leung. I am an AAMG ear, nose, and throat doctor, and also chair of the board of St. Francis Memorial Hospital. I'm not going to repeat many of the information that the previous speakers have given, but the basic idea today is to emphasize the importance of social distancing. As the other speakers have mentioned, coronavirus is easily transmittable. We do not have a vaccine as of date, and we do not have any medications to cure this disease. So the one weapon we have against the transmission of coronavirus is social distancing. The idea of social distancing is pretty simple. Stay at home, don't go and gather with other people. If you have to go outside, please maintain at least 6 feet distance away from other people and avoid crowded places. Don't shake hands with people, please wash your hands more often, and don't touch your eyes, nose, or mouth. Now, if you're worried about having gotten coronavirus, it's best to contact your doctor. Many doctors' offices can perform televisits now, either through the internet or via phone, and you don't have to go to the office in person. If you have more serious symptoms, such as really high fever or breathing difficulties, then go to your local urgent care emergency room. At St. Francis Memorial Hospital, we have dedicated beds, up to 40 beds that are dedicated to treating people with coronavirus. And we have also have undergone safety training and protocols for everybody, every healthcare worker in the hospital, so that we can take care of coronavirus patients safely and carefully. So the most important thing I could say today is please, for the benefit of yourself and your family and your community, please maintain social distancing so that we don't transmit coronavirus to more people. Thank you for your attention today.
Thank you, Dr. Leung. Now I'd like to introduce my friend of the last 25 years, the Chief Executive Officer of both the Chinese Hospital and the Chinese Community Health Plan, Dr. Jin Zhang. Are you there, Jan?
Yes, I am. Thank you, Dr. Wu. I muted myself because I have to run in and out. I'm sorry. Yeah, good afternoon. On behalf of Chinese Hospital and CCHP, I would like to thank San Francisco elected officials and especially our district supervisor, Supervisor Peskin, for their leadership, the community leaders for their hard work in conveying all the evolving messages, literally evolving. I feel like every day, last hour and this hour is different. You know, there are a lot of messages going going back to the community and their associations. And most importantly, I really want to thank the frontline doctors, nurses, housekeepers, and all other supportive staff for their dedication and courage in taking good care of our patients during this most difficult time. Of course, our media friends, right? They are the ones running around, taking important information and disseminate it to the community. And it's very, very important. Thank you so much. And ever since the end of January, Chinese Hospital has been working very closely with San Francisco Mayor's Office and elected officials, San Francisco DPH and San Francisco EMS, in fighting coronavirus. Indeed, Supervisor and I sat side by side at the very first press conference on February 1st in Chinatown, so informing the community about coronavirus and how to best prevent the infection. Ever since then, we have been doing a lot of community outreaches to educate the community and to prevent panic reaction from the public. So as a result, I think we, the community, collectively did a great job. And we don't have an outbreak in Chinatown, and we don't have public panic reaction. Great job to all of us, to the community. And I think it's a great thing, and we need to maintain that, right? Our seniors at the SROs, they are the most vulnerable populations. We need to protect them. We cannot afford to have an outbreak in Chinatown. So as the COVID-19 situation evolves, Chinese Hospital has been actively involved in a citywide CEO calls at least twice a week. So I just had one at 2 and actually had to leave that one a little earlier for this one. And then some new things that happen on the other end, like Supervisor Peskin just said. So great thing in San Francisco is that on a CEO level, all of the CEOs in San Francisco, together with San Francisco DPH, and we are working together as a team. So we call this a San Francisco COVID, against the COVID team, right? So we strategically plan on the high level that what we should be doing. And then we have our CNO, COO, CMO teams. They're planning on different things. So we are really a cohesive team in San Francisco. That's why I think we're doing much better, like Supervisor Peskin said, compared to our neighbor counties or other states. So all hospitals in San Francisco, under the leadership of San Francisco DPH, we have been working as a really well-organized team in this together. No hospital is left alone in this journey fighting against the virus. Internally at Chinese Hospital, our management teams, our medical staff leaders, and in-house physician leaders are meeting every day. We activated the HIT, so we meet every day to adjust our plan for the potential surge of the coronavirus. Just like other hospitals, we designated different floors too for different use of the COVID-19. So as you all know, we have a lot of space, we have capacity, right? So we're working very closely with the city to best use our space. So we are prepared. So under the special shelter-in-place order, private practices are closed. So we convert our clinics into urgent care clinics to screen and test patients because our fellow doctors and because they don't have the PPEs and they don't have the capacity there at their private offices to test or care for COVID patients. So that's why we quickly converted all not all the clinics, 2 of them, into urgent care clinics to help out. And then so we teach our community, our patients, to call the PCPs, call them for instructions. Some, like Dr. Leung said, a lot of the PCPs can provide consultation on phone or on a telemedicine base. And for those patients who need to be screened and tested, then they can refer them to the testing clinics. So before they come in, our staff will bring a mask and then put them on the patient so they don't come in to infect our other patients or providers. So that's how we have a plan for that. If those patients are sick enough that they need to be seen by our ER doctors, then we will kind of refer them to the ED. And so they will take care of them. If they need to be admitted, then our there's absolutely no need to panic. And so, and also too, for those like Supervisor Peskin said, if you do not have a PCP, they can call our clinic number directly. The number is 415-677-2370. Again, it's 415-677-2370. And our providers will help screen you on phone or arrange it for you to be seen if needed or to be tested. And if you have a PCP, call your PCP first. Like Dr. Mankin Luck said, social distancing is crucial to control COVID-19 spread. So please stay home. Just like my ED team said, you know, we stay at work to protect you, and please stay home for us. So wash your hands, cover your nose and mouth when you cough, stay home when you're sick. Please do wear a mask if you think that you have COVID-19 and if you need to be seen but you don't have one, please call in first so our staff can bring one out for you. And so we need to protect each other, right? The frontline healthcare providers, they cannot get sick, right? They need to be there to take care of our community. So again, there's absolutely no need to panic. Together, we will control the coronavirus. We will. So I'm going to say it in Chinese, summarize it a little. 大家好，我係張敬千，係東華醫院嘅行政總裁。喺呢度咧，我好想多謝咧係三藩市我哋嘅市政府，特別係我哋嘅 Supervisor Peskin 佢哋嘅領導力，同埋咧佢係有開始到而家咧，佢哋就好帶領我哋咧係做到好多嘅社區嘅工作。咁樣，所以我哋唐人埠咧我哋社區嘅領袖同埋我哋嘅醫務人員，我哋同三藩市EPH 同埋三藩市嘅緊急處理中心，大家一齊努力咧，同埋市長嘅 office 咁啊，我哋咧大家咧共同嘅努力咧，咁唐人埠到而家為止咧，我哋都冇冇一個疫情嘅步伐 ，which is great， right？ 咁咧仲有咧就係我哋嘅社區咧，亦都大家好合作、好配合，呢個咧係我哋大家嘅功勞。我就好想多謝我哋前線嘅醫生同埋護士同埋其他嘅工作人員，佢哋咧真係好努力嘅為我哋喺度工作，即係佢哋亦都有家人嘅，亦都有都會擔心嘅，但係為住我哋嘅社區咧，佢哋咧就照常嚟返工，毫無怨言嘅，所以我哋好想多謝佢哋。仲有咧就係、如果你邊一日見到佢哋嘅話咧，或者係你嚟醫院或者出面見到佢哋咧，唔該同佢哋講一聲多謝。咁仲有咧就係、我哋嘅媒體嘅朋友， 佢哋真係冇你哋嘅話咧，咁我哋係冇辦法將我哋嗰啲重要嘅信息咧係傳到我哋嘅社區嘅。即係好多謝你哋係咁辛苦咁樣為我哋嘅社區嘅工作呵。仲有我哋嘅警察局同埋我哋嘅消防局，我哋真係大家一齊努力咧，先至會我哋有今日三藩市同其他嘅地方比起嚟咧，我哋係好好多嘅。咁咧同你講聲咧，就係東華醫院咧，由1月尾開始咧，就好緊密緊同三藩市嘅市政府啊，同埋嗰個公共衛生局啊，同埋緊急處理中心咧，係一齊工作嘅。因為嗰個 COVID-19 嘅情形咧，係每一日都喺度變嘅。咁東華醫院嘅計劃咧，亦都係跟住變嘅。咁東華醫院咧，同其他啲醫院一齊咧，係三藩市有其他所有嘅醫院咧，都同三藩市嘅EPH 咧一齊。咁咧，我哋咧所有嘅計劃咧都係一齊進行嘅，冇一個醫院係自己行動嘅。所以我哋有高層次嘅 CEO 嘅 meeting， 最少1個禮拜2次。咁跟住下邊咧有啲CNO 啊、COO 啊、CMO 啊，唔同嘅層次嘅meeting。我哋內部咧每一日我哋嘅管理層啦，同埋我哋嘅醫務人員啦，每一日都有 meeting 嘅，即係根據嗰個疫情嘅變化咧，咁我哋就改變我哋嘅計劃嘅。咁我哋都特別咧係有專門為呢個COVID-19 咧有特別嘅計劃嘅。即係譬如講咧，我哋因為嗰個 special order 咧 shelter in place 執行之後咧，咁東華醫院因為好多嗰個我哋嘅社區嘅醫生咧，就佢嘅門診就要閂咗，因為佢係冇嗰啲 PPE 即係嗰啲防護嘅物品咧，可以嚟用到，可以嚟照顧嗰個 COVID 嘅病人嘅。所以咧，我哋就將我哋嗰啲門診咧就改到去做 urgent care， 跟住咧就可以用嚟咧去嚟幫嗰個病人咧係嚟做檢查啊，或者係冇咁重嗰啲病人咧喺嗰度處理嘅。跟住個重嘅病人咧就係去我哋嘅急診室啦。如果需要入院嗰啲病人咧，我哋亦都有特別嘅嗰啲係專門嚟管理嗰啲新冠病人嘅，即係個住院病人嘅。所以咧，如果係你有咩唔舒服嘅話咧，你有家庭醫生咧，就先打電話俾你嘅家庭醫生。咁你家庭醫生咧就會教你點樣做㗎啦。如果你家庭醫生咧覺得你需要檢查嘅話咧，咁咧佢就會打電話俾我哋嘅急症中心或者係我哋嗰啲檢查中心。咁如果你冇家庭醫生嘅話咧，就你可以打我哋嘅門診嘅電話咧，係415-677-2370 415-677-2370。咁樣咧，我哋嘅醫務人員咧就會幫助你，講俾你知你需要需唔需要嚟做檢查啊，或者係留喺屋企就 OK 啦咁樣。咁咧佢會幫助你㗎啦。總之咧，你係唔使緊張嘅。我哋成個三藩市係有一個好完整嘅計劃。咁東華醫院咧亦都喺呢度24小時開放嘅 ，absolutely 完全唔可以恐慌，大家咧唔使擔心。如果有咩事咧，咁咧就打電話嚟問。咁你打電話俾你嘅家庭醫生，我哋大家一齊配合咧。就好似我哋嗰啲我哋嘅前線嘅工作人員咧，有一個 message 要我講俾你哋知，佢哋咧好辛苦咧喺前線工作，係為住你同埋你家人嘅健康。佢哋咧希望你哋咧係屋企咧就留喺屋企，就唔好引起嗰個傳染，亦都唔好引起社會嘅恐慌。咁樣大家一齊努力，一齊合作咧。我哋一定可以控制到呢個新冠病毒嘅。多謝大家。
Thank you, Dr. Zhang. Since our hands are clean and we're not touching our faces, we're going to switch gears. And in the interest of time, go to one language, whichever one is the most comfortable for the duration of the last speakers. I have the honor again to present the captain of the Central Station of the San Francisco Police, Captain Robert Yick.
Thank you, everyone, and English will be just fine, Doc. So, thanks again for inviting me, Annie, for arranging this partnership. Where's Victor? Thank you. Where did Victor go? Thank you very much for providing all of the handouts and materials. Supervisor Peskin, taking my calls day and of course during the evening hours and working together on this. I know it's a very difficult time for everybody. What are we doing at the police department? What we're doing is we're taking the same precautions ourselves. I know that those of you that have been at Central Station, that it's a tight place, but yet we're also practicing social distancing. We're using one point as ingress and the other as egress. So you'll see the officers, if you're at the station, walking in one door and pretty much out a different door. So we want to be able to practice that and show that, you know, we're doing that as well too. And we would like to see that with the public as well. So what have we done since? I know that there have been some concerns in regards to our business districts. So that is a focus for us. I know a number of the businesses that have been deemed as non-essential are closed as a result. We appreciate that a number of the merchants have taken the opportunities to either more fortify their businesses and or even removing items from the front of their storefronts because people shouldn't be walking around just window shopping at this point. So I will say, knock on wood, we have not had any serious issues. We do have a number of officers and sergeants that are assigned to the station on a daily basis as a result. So we do have more personnel than we normally do. So we're able to look out not only for those that are patronizing those essential stores and buying their produce or at grocery stores or drugstores, but also looking out for the district as a whole. So you should be seeing a lot of us out there. What else can we do? I know that we have a number of seniors in our district that will be out shopping. I'm asking for those family members and friends to assist those seniors in doing their shopping. And in doing so, they can do that for other friends or family members, and that'll keep the amount of people that are on Stockton Street shopping, and then we can best practice social distancing as a result. So I have seen those numbers diminish. I know that there was an issue also at Portsmouth Square, and that has been addressed as well. So I'm pleased to see, and thanks to my footbeat officers, that we did have a number of people that were still congregating at Portsmouth Square in small groups, and I've seen those numbers diminish. And that was a conversation, of course, and a concern that Supervisor Peskin and I had discussed and had. So I'm pleased to see that, and I'm really urging those that are listening to this to please continue doing that and to practice that and stay at home, especially if you're a senior. Please do that. I really appreciate the media for being here. I'm happy to answer questions and or to dispel any rumors. What else are we doing in the district? We're not actively looking to cite those that may be out, because if you're out shopping at an essential store or performing a function, then that is fine with us. But yet, if the officers see the same people that are out and that they may not be, I mean, they do have the right to engage in conversation, and they will have those discussions just to make sure that you're in compliance with the order, because everyone needs to work together on this. The other thing that we're doing is we're making sure that the essential businesses are open, but also the non-essential businesses are closed. So I will share with you that there have been businesses where incident reports have been prepared because they have not been compliant after asking them several times to remain closed. So that has happened as well too. The other thing I know that has been going around social media is a question of those that are walking around in the business districts. So again, I urge people who are either coming from other areas to consider this in the future when we're not practicing social distancing and when they should be at home, and or if they have to do other essential functions, to do that in their either respective areas or areas that they should be. So we appreciate that. And this is also something where my footbeat officers have been working with and with them as well too. So with that, again, I would like to thank all of the partners that we've been working with. Again, Victor for providing all of those materials. And again, Supervisor Peskin for his support, because without him and his staff, I would not be able to receive all of the feedback and all of the comments and questions, because I really feel this is a time where everyone is looking out for themselves. So we have emails in regards to questions about essential and non-essential businesses, what people either should be doing or not be doing, and we've been able to answer those questions. So please refer to the city website. If not, feel free to call the station. We do have officers that are bilingual that can answer those questions, and our number is 415-315-2400. Again, thank you very much for your time.
We're just going in one language. Thank you, Captain. I'm going to wear my white coat on the street just to be safe so I don't tangle with you guys. No, we're just going to go in one language in the interest of time. Now I'd like to introduce one of my favorite guys, a pretty funny guy, actually, Reverend Norman Fong, the Executive Director of the Chinatown Community Development Center. Reverend.
Thank you. I'm so glad to say a few words. I have a board meeting at 4 o'clock, so sorry. Number one, I love Chinatown. I love our seniors. And I don't want you to go to the doctors. So I'm talking about prevention. If如果我父母如果我親戚住係頭人翻我嘅山房I would bring them home. Because in the SRO, it's just too crowded. And you have to share the bathroom and kitchen. So my second message is family, take care of them or call them every day, check on them, okay? Number two, half of Chinatown are SROs, okay? So all the family associations and private owners, including us, we have new standards the city has said we have to do. Do you clean your bathroom and common areas every day? Do you use disinfectant? All right. Do you have soap dispensers in every sink? Stuff like that we have to do now. Okay. Right? So if you want to save lives, clean the bathrooms, clean the kitchens. Number three, I hear from my staff that sometimes in Chinatown's SROs, they fight over the kitchen. I think we got in trouble from one inspection because somebody took the toilet paper. So everyone who lives in Chinatown, the seniors too, have to learn to be patient and share and not hoard. We're in this together. So far, no one in Chinatown has got it, but you gotta work together. Watch TV in your room and you'll save lives. Okay, just stay in your room. Maybe we'll create some new exercise programs, Qigong or whatever like that. But anyway, I'm trying to keep it really fast. Chinatown is unique because we have so many SROs. We need to be pull everyone together to either help volunteer for self-help to deliver the meals, or and there's so many things we can do. So my main thing is keep our Chinatown spirit strong in fighting this disease, but always, there's keep hope alive too. My family members, my co-pastor at the church, they face COVID-19 on the cruise, and they kept social distancing and protecting themselves, and they made it. They did not get sick. Our pastor just came home yesterday. My relatives came home last week. So I know we can beat the disease if you listen to what the doctors just said, social distancing. But I also want to say that last Saturday, I saw a whole bunch of young Asian kids lining up like right next to each other, buying bubble tea. You're supposed to separate. Anyway, you get the point. I have faith, work together. Landlords, building owners, help clean up the bathrooms. It's not easy, but we got to do it. All right. Bye.
Okay, thank you, Reverend. And our last speaker, good friend of mine, Annie Chung, the CEO of Self-Help for the Elderly.
Thank you, Dr. Wu. I'll be very brief. I want to first thank Aaron for coming today and spending time with us, and also Victor for also really every day Victor Lim provide us and our community the most updated information. So we really appreciate that. Why we need to form this task force actually started with a very innocent question from my board member and said that, Annie, do you know that people should not take ibuprofen because that's not good for us? I said, yeah, I saw some posting in the web that people could stay away, but what is ibuprofen? People don't know. My seniors definitely won't know. So I called up John Williams at AAMG, then got in touch with Dr. Joseph Wu and Esther, and then we started saying that when things we see and read in the paper, and if they are health related, how do our community that don't speak English get it? And if they get certain information, how do they know it is true? What is a fact and what is not a fact, what is a myth? So a lot of fear is generated over COVID-19 because a lot of our community needed a place to ask questions and also get resources. So we're forming this task force with the hope that we're inviting a lot of community members who work with our community on healthcare, on housing, like Norman, CCDC, like CTA with the SRO tenants, with us and unlock with seniors. And also there's this anti-Asian sentiments because the president called this the Chinese virus, which is not acceptable. But where do we collect all these complaints, Aaron? Do we bring it to you? I know that the Board of Supervisors probably will be passing an ordinance or have passed already that we cannot call it the Chinese virus because it makes people look at us differently. And I'm sure that we know our friends and relatives who already say, take your virus back to China or don't come near me, things like that. So as a community, just like Norman said, and just like Jing said, we could overcome this COVID-19, but we cannot just think about ourselves. Even for us, we cannot just think about the needs of our seniors. We also have to expand it and also think about our families, our children, and our youth. So now I'm gonna just make a call. 9 days ago, Aaron, we were delivering 400 meals. That's our regular home delivered meals program. We bring it out to the homebound seniors who could not come to our 15 meal sites. And we also bring it to the young people with disability, but who also needed a home delivered meal. Today, 9 days later, we're delivering 1,300 meals a day. You see all these things right behind you and over there. It's these massive efforts to try to feed our seniors under these crises. And we maxed out all our vehicles, we maxed out all of our staff that we could put in home delivery. So I want to now call a lot of our community to action. If you have family members that are elderly, please take care of them. This is the time they need you the most. Buy groceries, but do not go in to visit. Call them every day, call them a couple of times, keep them engaged in the home. Don't make them feel that everybody is abandoning them. We certainly are not. We have social workers that are still making wellness checks. But we ask young volunteers who are healthy and have some time, might not be working, to now join our volunteer so that we could deliver. By today, we're delivering 1,300 meals. Every day, we're taking about 100 calls from elderly who need a meal delivered to them. By next Monday, my staff told me that we'll be delivering 1,700 meals. It is increasing by almost 100 meals a day. And we need volunteers now to join us to fight this disease and take care of our most vulnerable. So I'm asking our media friends, and Aaron and his staff have already been volunteering as well as pulling in some city employees to help us. But we're also going to need vehicles and masks, and aprons and gloves, which we are very low supply. But I know that we could do it, and I hope that all of us who work together support Jane at Chinese Hospital, Norman at CCDC, us at Self-Help, and support our city family. They are working very hard to take care of a lot of important issues, and we have to do our part. So we will ask our senior, just like Norman will ask his tenants, to do social distancing and stay at home, self-isolation. And Victor, whatever news you pass down to us, we will get it out to our community. But really, let's work together. Let's support each other. And whatever information we could gather, let's find out if there's a true information, good information, then each of the member of the task force will spread it to their network. And in the end, I think that is going to, working together, we will overcome. So thank you very much for coming today. I know it's a long, because every time we do a press conference in bilingual language, it doubles the time. So thank you to all our reporter friends for coming today. I know that this is just the launch of the task force, right, Dr. Wu?
Right.
And in the next 6 to 8 weeks, working with Aaron and Victor and also Captain Yake and others, we're gonna probably pull together important and relevant information in language so that we could disseminate it through social media, through our own website, maybe pass out flyers when we do the home delivered meals. And when the SRO residents are taken care of and tested, Aaron, then we feel better. So when you have the 1 million masks, I hope that you will share some with also the nonprofit family. Because the first thing my resident manager asked me when I stepped in today is, Zhonggulan, do we have any more masks and gloves? So we need those supplies as well. So thank you very much, everyone. Yeah.
Thank you. And if I just may add a few things to what Annie said. So first of all, there is no place for xenophobia. There is no place for racism. There is no place for rumors. The mayor has made that abundantly clear. The chief of police has made that abundantly clear. And the Board of Supervisors had its first virtual board meeting in the 150-year history of San Francisco yesterday. And at that first meeting that we did not have in person, I was at the Emergency Operations Center. President Yi was in his house. Supervisor Fuhr was in her house. But because of this technology, we were able to have a meeting. The public was able to call in and make public comment. So democracy is still alive and well. And at that first meeting, we unanimously passed President Yi's resolution condemning what is really coming out of the President of the United States. There is no room for that. This is a virus. It knows no bounds. Other pandemics 102 years ago swept this city. So it knows no country and should not be in any way called the Chinese virus. It is absolutely wrong, and we condemn that in the strongest terms. Now let me move to what Annie said, and she is truly, and her volunteers in this organization, doing God's work. As you just heard, the city is actually assigning disaster service workers, city workers, to help in that effort. We are going to ramp that up. Victor Lim and I are going back to the EOC after this press conference, and we'll work on obtaining our very, very precious, limited personal protective equipment resources. And by the way, there are many, many people who want to help in my office. While there's nobody in there, and City Hall is now closed because we actually have COVID-19 cases at City Hall, so the building is now closed, except for the 11 of us and the mayor and a handful of essential employees. We are going to take whatever steps we can to make some level of personal protective equipment available. We've been getting, so we're monitoring our phones. So if anybody calls my number, 415-554-7450, we check it all the time. Calvin Yan checks it. So if that message is in Chinese, we can hear it and respond to it and assign it appropriately. And then I want to give you some very heartening news, which is we are getting so many calls from people who want to volunteer. And actually, Annie, I need to get the appropriate number because we are telling folks, particularly people in the district, particularly with cars, that they should come and aid this food distribution effort. And we've also been getting so many calls from people who want to volunteer supplies. So I wanted to say to all of you, We are really all in it together. We've been getting calls from the owners of downtown buildings where there are no employees, and they are donating to us Simple Green and bleach and Lysol and all sorts of things, hand sanitizer, gloves, some personal protective equipment, and all of that that is being donated, we're putting into the local SRO effort. So let's see if we can get you some, as they now say, PPE.
Any questions for any of the speakers from the press?
Yes, and in terms of the SRO family, I think the safest way is to keep them in a hotel during the shelter-in-place order. Besides enhancing cleaning service, will there be any plan to actually move them to SRO hotel, or what's the schedule for that?
So this is a massive military style exercise, and while it is true that under the emergency declaration we can move much more quickly because we don't have to pass ordinances, and the mayor can actually sign emergency declarations and emergency orders, we still have to negotiate with each hotel. So on Monday of this week, we brought on, Monday of last week, we brought on our first hotel. Monday of this week, we brought on our second hotel. We're negotiating each and every one of those. Our highest order is isolation rooms for people who are what's called PUI, persons under investigation who may have COVID-19. So I just have to be honest, and it's very important that the city be transparent. There's no way that we are going to be able to move 19,000 people out of 160 hotels. But what we are going to do is, if anybody has influenza-like indicators or are under investigation, we are going to remove them. Meanwhile, those people should stay in their rooms as much as they can. And when they use congregate facilities within an SRO, like a kitchen, they should not have 10 people in there. They're going to have to work with one another to do that. And part of the importance of meal delivery is so people can actually self-isolate in their rooms. But let me be clear, we're not going to be able to ramp up fast enough to pull 19,000 individuals out. We're going to reserve, our number one priority is to make sure that our medical system does not collapse. So we cannot clog up our ICU beds. We cannot clog up our medical surge beds. That's, by the way, exactly what's happening in New York City right now. Their medical system is entirely over capacity. We are looking forward to next week and the week after and planning for that on the medical side. So our number one priority is to put anybody who may have coronavirus or who does have coronavirus with milder symptoms that does not need to be in a hospital bed, that does not need to be in an intensive care unit, into those hotel rooms. I hope that answers your question.
Any other questions?
Is the cleaning service started to put in place right now?
Yes, with the my chief of staff, Sunny Angulo, has been working at the EOC with the SRO task force within the Emergency Operations Command. There's actually a SRO task force within that. Those supplies are being delivered. Those health orders are being signed, and that is actually happening now. There was a meeting this morning with the non-city contracted hotels where our public health officials made it extremely clear what standards we are insisting on. We are inspecting those. We have 2 inspectors who are going to those hotels literally as we speak. They have personal protective equipment, and if those surfaces are not clean and they're not doing what the city is demanding, they will be issued a misdemeanor citation.
There's a question.
Yes, sir.
Yes. Can you identify all the participants of this task force and what's going to be the operation of the task force, like daily or weekly?
Oh, I think it's been daily. The task force has been daily. We ramped this up so quickly. We haven't had a chance to assemble all the members of the task force. I think that everyone that's appeared today is a member. Also Nikos, NEMS. We have a few other responses out there. I'm not quite sure, so I'm sorry. At this moment, we meant to do that today, but you know we're moving so fast. Annie, did you have any comment?
I think as the COVID-19 evolves, we might be meeting up with new challenges, and as we learn more about the SRO, we'll be able to get that resources to also our seniors that live in the SRO. So we call it a task force, so it's more informal. We will go to members. We already know API Council has over 50 organizations, but we want this to be more the Chinatown Chinese community, so we can stay a little bit focused. And if you have good suggestions who we should talk to, we have quite a few just now from David or other people ask, oh, are you going to ask so-and-so or this organization? We're more than happy to. And what will happen, I think that in the next 6 to 8 weeks, we're going to get some information out again in language, very focused. Like if Aaron provides us more the SRO situation, we will have probably some of you focus and interview and write about it, either on TV, radio, and news, or sit down and talk to the doctors again, because a lot of our seniors are scared, and then they don't understand the whole testing. We don't have time today, but I really like Dr. Wu to spend a little bit time to talk about why our seniors are so reluctant to be tested. Because I think that first it might be costing them money, or it might be a painful procedure, or they might be isolated. All these probably go to their mind. So we like to one by one answer them with the experts, and so that our community knows what it is all about. And if you are tested positive, it's not a death sentence. The doctors will still take care of you. Our hospitals seem to be ready. So it's kind of that education that we would like this task force to get out. So give us your feedback, and work with us.
Thank you.
Aaron, do you know how many patients are actually recovered from the coronavirus?
So on an international basis, with about 461,000 cases, 1/4 of those are officially recovered. The data is out there, so let's talk about the data. The older you are, or if you have underlying conditions like diabetes or kidney problems, your mortality rate increases. From the age of 40 to age 80 exponentially per decade. The China experience was that individuals under 20 were virtually zero morbidity. Although we do have some cases in California where we've seen deaths for individuals under the age of 20. A lot of new information is being learned about the virus. So, bottom line is that the morbidity rate overall is about 2%, 1 to 2%. That has been the experience on the planet Earth so far, but it is an evolving situation.
How about in San Francisco?
In San Francisco, out of 178 cases, it is my understanding that half of those cases are in the ages of 40 to 60. I don't know where the other half of the cases are relative to age, race, or geography.
How many of them are recovered in San Francisco?
Hold on, if I can tell you that. I don't know the answer to that either.
I'm also with Visual Street Films. I have a question about the homeless population. I see a lot of them still out there, and it seems like they're not being affected. They're still all together, and tents are everywhere. What's the plan of action at this point?
So we have over 2,000 people in shelters, which is not a good situation because shelters, people are packed in. They are not able to socially distance. The city has, and you may have heard, come to the very difficult conclusion that we no longer are allowing people to come into shelters because we don't want to exacerbate the situation. We are making plans to thin those shelters out. It cannot happen quickly enough. You've seen what the situation is at Laguna Honda Hospital, which is also a similar type of setting, although it's a hospital setting, ironically, where that facility now is completely on lockdown and quarantine after some 5 city workers there have been diagnosed with COVID-19. As to our street population, of homeless, which is approximately 8,000 people. We are also trying to figure out ways to bring them indoors in socially distanced situations. That falls into kind of two categories. One is larger congregate sites. So we are looking at Moscone North. We're looking at the Bill Graham Civic Auditorium, as well as a number of other facilities. And it also means that in the same way as the rest of the populace that is showing symptoms and is a person under investigation, and those individuals are capable of self-care, we will put them in the same hotel rooms that I previously discussed.
And are you having any success with them, or are they kind of hard to reach right now?
Well, right now, the constraint is actually procuring enough hotel rooms fast enough and getting floor plates like Moscone North ready. So, and at the same time, as you heard from the medical side, we're trying to ramp up our beds. We're looking at opening facilities that were closed because of seismic safety concerns. And again, there are both human resource and physical resource constraints there, whether it is acquiring enough equipment, whether it is acquiring enough nurses, and in some cases, fixing infrastructure within those buildings that have not been used now for a number of years on California Street, the Pacific Campus, and that includes fixing boilers and other things that are literally happening day and night as we speak. If there are no other questions, thank you for getting the word out. Thank you so much to Annie and to Dr. Wu and AAMG. We are all in this together, and together we'll come through. Thanks, all.
Annie, 可唔可以咧？你企喺呢度咧，我問你幾個問題。
Oh, I do want to say one other thing. Victor. The other thing I want to say is that the Joint Information Center within the Emergency Operations Center, which is where Victor has been assigned, has been doing a terrific job of getting stuff out, getting the kind of information that we've gotten out today in this press conference over social media. I want to thank the SFPD because Captain Yik actually sent down Sergeant Colbert Chu and Officer Liang and I think Officer Ma yesterday, and they actually recorded messages that are now going on WeChat and other social media. So we're trying to hit this in every single conceivable way to give people the information they need. So thank you, Victor Lim, and thank you to the SFPD.
Annie， 冇人yeah， 我想問你要講Annie， 我講中文。
But thank you, everybody. Don't want to keep you longer than we can, but we'll stay here. Dr. Wu and I will stay here. I think Esther, can you stay? Eric, can you stay? If there are questions.
Annie， 我哋都好想知道呢個 task force， 你頭先講過點解我哋成為個 task force 同埋個 task force 其實係要做啲咩咧？大家都好想知道。
好啊。點解要有呢個抗疫呢一個聯盟咧？其實真係我頭先攞英文講咗，我再講啦嚇。咁係有一個董事阿 Linda 咧就打電話俾我，咁就 Annie， 你知唔知道用嗰啲 ibuprofen 即係 Motrin 啊、Aleve 啊，即係有幾種藥咧係唔好嘅，特別係啲人以為係減即係降低佢嘅 fever 咧，但係其實唔好食啊，情願佢食 Tylenol 咁。咁我話 Linda， 我啲老人家唔會知道乜嘢係 ibuprofen， 乜嘢係你冇個藥名咧，佢哋唔會知嘅。咁我哋兩個傾偈嘅時候咧，就發覺話原來 COVID-19 真係有好多關於佢哋藥啊，戴唔戴口罩啊。有好多問題，我哋識英文嘅咧，就喺電視同埋喺其他嘅傳媒都睇到啦。但係唔識講英文啲老人家或者啲唐人咧，就真係對呢啲知識係冇唔係好深入嘅。咁所以Dr. Wu 咧就係代表 AAMG，Esther 咧就係代表佢哋個 Health Education Manager。咁我哋覺得好喎。係唔係我哋識中英文嘅，又有 doctor， 又有我哋社區嘅機構，然後我哋可唔可以 pull together？ 我哋又識得好多人啊，好似 Aaron 咁，佢哋有好多資料嘅其實。 咁我哋係咪應該form 一個 group 仔？所以今日個名都係Dr. Wu 話，不如叫做 The Chinese Community Task Force 啦咁我話好啊，因為如果陸續呢6個禮拜咧，我哋有深入啲嘅認識咧，同埋知道去問邊個攞啲乜嘢嘅資料咧，咁我哋可以一齊咁樣去一齊去做呢一件事，唔係話淨係安老或者淨係 CCDC， 我哋淨係 take care 我哋自己啲 client 依家都頭晒痛，咁但係一齊做，好似Hygiene Chinese Hospital， 佢有幾多個床位咧？係咪病人去佢哋做 testing 咧？嗱，今日阿 Jane 講得好清楚嚇。咁 Dr. Wu AAMG 佢哋咁多 doctor 咁熟關於啲我哋唐人嘅需要嘅，好似好多唐人都唔識得話可以繼續 call 啲 doctor 去用個 telephone 或者去用個 computer 去問下個病徵點係點。咁我覺得呢個係非常好嘅一步咯。最好呢個 task force 亦都唔係話好 formal 嚇。咁我哋準備話。你哋又日日都需要有新聞係講，咁我哋話不如我哋 match up 啲 media with 一班 doctor 或者 with 一啲社區嘅機構，咁大家一齊合作去盡量去傳播，即係好似 social distancing 咧，我哋同阿 Dr. Wu 講話，唔係喎，我哋啲老人家明唔明白乜嘢係 social distancing 啊？你喺 market 咧，佢哋爭先恐後咁樣去擁上前，咁人哋啲人已經驚咗佢啦，係嘛？即係又有好多誤會發生嘅。咁我哋都係話呢啲都係需要自己人去教育翻自己人。
咁我個 task force 想做到啲咩？譬如我哋4個星期開一次會嘅，同大家公佈下有啲咩 update 嘅最新消息。
我諗我哋唔會等4個星期，我諗我哋每一個星期會叫埋一啲 task force member， 冚唪唥都係起電話用 Zoom 㗎啦。咁問下今個禮拜係咪？如果啲係邊一方面最緊要咧？好似藥物，我講開，依家都冇人未講藥物，即係都未。但係中藥咧，係咪有啲可以幫助咧？我哋都未有機會去研究呢一個問題。咁我就 mention 咗 xenophobic 啦，因為真係越嚟越多呢啲歧視嘅 case， 但係亦都有啲誤會嘅 case 嘅嚇。咁所以我哋想真係即係深入去做一個 topic， 然後。俾一啲 resources 俾佢去訪問邊個咧？佢真係有啲例子嘅。咁呢個就係 task。譬如話4個禮拜後，個情形係 calm down 嘅話咧，咁我哋咪 disband 咯。唔緊要，因為我哋個自己都有一個機構嘅嚇。咁呢個都係我哋做成功咧，都係我諗會成功嘅，因為今日都有9個 speaker 啦。咁然後我哋又invite咗東北啦、安樂啦、CAA 啦，咁佢哋要有時間去同佢哋嘅董事會同埋啲職員討論啦。因為我哋真係好今次組織呢個 task force 好快，但我相信如果話Chinese company 需要參加或者總商，我哋諗過話好唔好去通知啲商人嘅，因為我哋嗰啲鋪頭咧逼起上嚟，啲鋪頭都有責任去 distance 佢哋。人哋西人嗰啲 market 咧就擺晒啲藍色嘅膠布喺度話一個咁樣嚇，呢啲都係教育呢個。但係如果由西人嘅傳媒教出嚟咧，咁啲人又唔接受。但係如果由我哋自己華協、安老、安樂、然後東北呢啲冚唪唥，其實個社區啲長者都係嚟自咁多個呢啲團體嘅，咁我哋自己講翻咧，可能會受用一啲。咁
每個星期嘅會唔會係固定喺星期幾啊？跟住有唔同嘅話題。
你覺得我哋應該點樣同你哋合作咧？我哋未諗固定嘅方法，因為 press conference 你知今日take幾耐時間，同埋好多阿 Tony 啊、Tyler 佢哋同埋 Esther， 哇 work 咗成6-7個鐘先至駁到咁多嘢嚇，所以召埋你哋一齊又係唔係幾好咯？係咪？咁你可唔可以 zoom in 同我哋傾下偈咧？可以㗎，可以啊。可以，
或者我用電郵嘅方式將啲唔同問題啊、唔同時間問題發俾你哋咯。好啊。好唔好咁啊？或者你哋有一個節目嚟緊咧，話 Annie 好似1日26台都叫咗我去做佢哋今晚嗰個，咁我哋話唔係喎，呢個題目應該揾阿 Aaron Paskin 去喎，定係咁嘅。你聽到佢真係好多資源，好多資源係真係好多資
源啊，我哋要去爭取啊。
我想問你哋嘅 task force 除咗係 educate 啲 public 同啲 seniors 之外咧，仲要會唔會諗過溝通嘅作用？因為你同啲 rumors 啦，其實啲人會不斷傳 rumors 喺度嘅，
嗰啲 WeChat 西啦，
但係可能 city official 啊，或者係警方佢哋唔知道有呢啲 rumors，一定要我哋點樣？係依個你
嗱我哋可以隨時都 include 阿 Victor 同阿 Aaron Cass， 佢哋我諗係好樂意即係嚟知道我哋嘅 feedback 嘅。但係每一次嚟咧，如果你要中英文講咧，又係 double time 嘅嚇。咁但係如果 Victor 有啲資料，我都係成日 call 佢嘅。喂，有人話唐人埠搶劫喎，咁係唔係即係佢哋會知道啦嘛。因為喺 WeChat 嗰度咧，有時傳得太犀利嚇。但係我今日請阿 Captain Nick 嚟都好緊要嘅，因為啲人係好驚嘅。你喺 Union Square 呢啲門口都幫晒，犀利啊！係咯，我講聲。因為 So Joe, I think the reporters have a good question. Is how are we proceeding? In what format? So I asked them to give us their input.
Yeah, I feel like it might be like a
once a week.
And also we can have a direct channel with all of you to ask all whatever questions
That's actually
we get.
perfect
Whatever
because
we get from the community, like
we don't even have to do it like this. I mean,
Yeah. Not like really
just
physical.
individual. I'll send you all of their, if they don't mind, I'll have
Create
to send you the email and the cell phones.
And we can send out email to you, and then you can maybe
directly
Absolutely.
make it a digest or something.
Or if you have a certain topic that you think your readers want to know about, then we should respond to that. Because if you have that question, your readers have that question.
Okay,
we should respond.
Yeah, we can cut it off.
Hey, Esther, go away. Dr. Lim, go away.
Okay.
Okay.
Thank you. Thank you so
Okay.
much. Thank you, Tony. Bye-bye. Thank you
Okay, bye.
for your participation. Bye-bye now.